Hello, Rogers viewers. You're joining us in the Rogers studio for Health Matters. We are here today with our Mental Wellness Changing Steps show. And my name is Theresa Fraser. I'm a registered psychotherapist here in Ontario and a certified child and youth care practitioner, as well as a certified play therapist supervisor, which means I get to work with children, youth, and families, not only around mental health issues, but in helping families feel like they're being the best they can be and focusing on health. It is my great privilege here to have Irena Razanas. Did I pronounce your last name properly?
Did.
Yeah. I just call her Irena, so it's the last name we have to work on. And I was sitting here thinking the last time I actually saw you, I think, was in Niagara Falls.
That's right. Play therapy conference.
In the Play Therapy Conference in Niagara Falls. How long ago was that? 4 years, maybe?
Yes, probably 4 years.
Yeah. And we had just an amazing lineup of play therapists, not only from Canada, but in the U.S. join us. And Irena is well known in the play therapy world for a whole bunch of reasons, but most recently she did training for not only play therapists but adoption practitioners, attachment specialists on grief and loss. So I invited Irena to the studio today to talk about grief and loss with children. And maybe you can introduce yourself to the audience in terms of, you have many designations besides being a play therapist.
Well, I am a social worker and a registered play therapist here in Canada and in the U.S., because we've been working on that for a number of years. I actually work at Hospice of Waterloo Region, and my job there is Director of Clinical Services, so clinical support services, really working with families who are dealing with someone who is really very ill.
Right.
And we also have bereavement programs that we've run, and I've done that there for just over 10 years.
Wow.
And previously worked in Montreal for an organization called Hope and Cope, which had to do with cancer care and support. So I've been doing this for a long time, and so I come across this bereavement and loss pretty easily. Like, I've learned it over many, many years, and then in the past few years, more interested in teaching other people about what's happening. But I do like to work, so that's where the play therapy comes in, and working with kids and families.
It's such, like, as an area of practice, there's lots of therapists out there that say, I just can't do grief and loss, let alone therapists. I can think of some referrals that came to me because the therapist had cancer and hadn't let the clients know that she was dying. Which really speaks to, one, it's unethical. We need to be clear about our availability, and then also have some plans in place for who can pick up if something ever happens to us, and let our clients know that. But for me, it really spoke to her ability to come to terms with her own mortality and being clear with the people around her about what she needed as she was ending in that last phase of life. So you're a pretty special lady. There's a lot of people that can't do this work.
Well, and often people ask us, how can you do that? And I think the reason those of us who work in grief and loss can do it is because we know that people get better. This is something that, first of all, I don't like to pathologize.
Right.
So just because we have a loss doesn't mean that there's going to be something wrong with us, or that we necessarily need professional help, first of all. Yes, it's true that losing a parent or a sibling when you're very young, that is unusual. And I always tell anyone that I'm working with, that we're training anyway, that you're working with a very small slice of the population.
Right.
This doesn't happen to everyone.
Right.
So yes, you have to find someone who knows what they're doing to help you out with your kids, and help parents, especially when they're dealing with a loss themselves. I think that's a big part of the work that we sometimes neglect. So yes, our focus is all on our kids, and we don't want them to be unhappy. And we can talk about that too.
Right.
It would be natural that someone would be unhappy if they lost their parents. So how do we work with that? But also, how do we support parents so they can support their kids through the process?
And I don't want to sound harsh, but death is a normalizing experience. We all are born and we all die.
Right.
Which means our loved ones come to the world and they also leave the world.
Right. But remember, in our culture, we don't want to talk about death, and we don't want to talk about dying. So our focus, especially with people who are very ill and they're young, is all on cure, and no one really wants to go over to, well, what if this doesn't work out, right? So by the time I see people, very often in our culture anyway, we're very close to the end.
Yeah.
And usually it's the parent who we sort of see as the surviving parent that calls and says, you know, I know this is going to happen. Nobody wants to talk about this, but can you help me to know what to do? And that's a lot of my job right now anyway. So we work
Well, it's
with
such an important job. I can tell you of 3 cases that I've heard of in the last 3 months where the person who was dying, you know, only told their immediate family, didn't want to tell anyone else that they were dying, or that children knew but they were instructed, we're not talking about this, which really then compounds the impending or the anticipatory grief and loss with, you know, who are they going to connect with for support people.
Exactly.
Both before someone dies and after someone dies.
Right, and that's probably what we used to do wrong. We didn't allow spaces for people to talk about things. I really believe that we can work through almost anything if we have support, right? So that's where we're trying to put the supports in for our children. If we are too preoccupied and can't do it, then let some other folks in, let your community in, let your aunts, uncles, grandparents, extended family in, church communities, people from your synagogue. Who wants to help? Who's saying they want to be there? And I always say to people, when you know that something is going to happen and people are saying to you, can we do something? Make a list, let them help.
Take advantage of it.
It can only help the situation. So yeah, that's very, very important. We have to let the dialogue happen. And we can avert a lot of problems if we make room for conversations. We don't have to go there all the time, but we have to make some room for those conversations.
Yeah, or at least help family members know who they can have the conversations with if they can't. As you were talking, Irena, it really made me think about even just how we manage when people die. So in my PhD work, I'm doing Santray work with folks over 55. So I've really dug in deep the last couple of years, and in so doing, became ordained as an ecumenical minister, and then became a death doula, and all of that reading and work and study really made me think closely about just even funerals now. Like when my family came from Ireland. They had another family they sponsored from Ireland. They sponsored them, and the deal was they sponsored them, and then our family would get funerals at a more reduced cost. So I spent sometimes in my childhood, I can remember being at the funeral home and hanging out. Like it was, and in Ireland, when I went to see family members a couple of years ago, a sister-in-law, her mother, I said, where did you do the funeral? And she goes, well, we just laid her out in bed. Like, the body was put in the bed, and the family would come and say their goodbyes, and the children were, she said you'd have grandchildren, sitting on the bed and talking to the deceased grandmother, and then people came downstairs and had dinner and breakfast, and then the morticians came and took the body to the church for the funeral. Very different than, our 2 days at a funeral home maybe, or maybe 1 day, and then going to a funeral home and often I'll hear from parents, should I let them come to the funeral or not come to the funeral? And you probably get that question a lot too.
I get that question a lot. And once again, if people are talking about what's happening and normalizing as much as they can, there's nothing wrong with people being exposed to a dead body in that circumstance, right? Where everything is predictable, calm. We're not talking about a trauma here, that's different, right? But we're talking about a predictable funeral. Of course, children can participate.
Right. And you also said something that was really interesting when you were talking about the surviving parent calling you and talking to that parent about, let's make sure you're getting your needs met, and that, where are you at in this process? Because I think sometimes, always as parents, we're always going to look to our children, but we have to be, the big buzzword is we have to be regulated. We have to co-regulate with the child. And it's really true that children recognize when things aren't quite right with the surviving parent. So having conversations with them about, how is this going for you? Where are your supports? Do you know what are you expecting is going to happen when people come?
Exactly. So, having a few of those conversations, and I do a lot of that over the phone, because people are really busy at that time.
Right.
And they're either going to a hospital or a hospice, and they don't always have time to come in.
Right.
Just answering their questions, giving them confidence that this is the right thing, you are doing the right thing, especially with very young children too. So 3, 4, 5 years old, you can't expect them to have a a great attention span. So they may participate in parts of these ceremonies, but then want to go off and play. So having someone else in the family there who can take them by the hand and look after that child or take them outside to play would be normal. And just giving them that room to be who they are. We can't expect kids to sit so long through these kinds of things. And that way everybody can do what they need to do at those, during those ritual times, you know. And I think the rituals, whatever faith or belief system we have, look at all the different parts, you know. They're there actually for a reason. And the longer I work in this field, the more I see how valuable they are. And, you know, we have come to a time now where we're developing other kinds of rituals. So people go to celebration of life, but they have to just watch that piece before, you know, have they skipped over actual seeing the body, knowing that the person has died. And that's important for children too, to know those pieces. We always say as children, as you see their ages get older, so let's say 7, 8, 9, 10, 11, 12, they should have a choice. Do you want to do this? Here's what we're going to do. Do you want to come? I'm going to be with you. We're going to be together and do it together. They may say they don't want to, but we want to give children more choices as they go along, and then respect what they choose to, and give them support in what they choose.
I think you've said it before we go to break. It's just so wonderful that you're basically summarizing that we want to try to explain to children in the best way we can, as well as other folks. There's many adults I know that have said, I've never been to a funeral and I'm really afraid to go to a funeral home. But a key point of that is to let them know what they can, you expect they're going to expect, and also prepare them. There may be some changes with that depending on who else comes home or comes to the funeral home. And that's part of the you said making space for the conversations. That's a beautiful way to say that we want to have those conversations. So we're just going to go to break, and I would invite you to grab yourself a cup of coffee or a glass of water, and then please come back and join us. And we're going to talk with Irena about after the funeral, what might be symptoms and signs that we want to either prevent through family support or other interventions, or what might be things that cause us to think we may need to get some additional interventions. So please come back to Health Matters, Wellness, Mental Wellness Changing Steps.